Back to talking about COVID-19. Case rates continue to rise across the nation, impacting some racially and ethnic groups more than others. Joining us right now to talk more about the disproportionate impact COVID-19 is apparently having on the Asian and Pacific Islander groups is KUSI political contributor Esther Valdes Clayton. Good morning to you, Esther. Nice to have you on.
Good morning.
And we have a pretty significant population here in San Diego in terms of Asian Pacific Islander. What are we seeing as it relates to COVID-19? How is this group being impacted?
Well, so much of the conversation around COVID-19 infection rates has centered around Black and Latino being the largest minority groups. But San Diego County is one of the largest counties with Pacific Islanders that reside here in San Diego County. Pacific Islanders, for those who don't know, comprise 5 main subgroups. They can be Native Hawaiians, they can be Samoans, they can be Guamanians, also known as Chamorros, or Tongans. Here in San Diego County, they tend to be concentrated in San Marcos, areas of National City, Chula Vista, and Imperial Beach. So it's really important that we separate the data. Most of the CDC guidelines have largely been addressing the Asian community and including Pacific Islanders. But what we're seeing now is that Pacific Islanders as a subgroup have had some of the largest COVID infection rates, even surpassing Latino and Black rates, and some of the highest deaths. And just to give you a little background, they are less than 1% of the US population. Here in San Diego County, what that means is close to 40,000 residents, but have almost 6 times the infection rate in LA County. And I was just checking the San Diego County dashboard on COVID infection rates just this morning. And if you pull up the data, what it shows is exactly what we're seeing nationwide. Not only does this community have the highest infection rates per 100,000, but it's disproportionate to what their true population numbers is. And it's a series of factors, both social, economic, also cultural, and also showing the disparity in terms of the underlying health conditions that lead ultimately to a COVID death. So this is something hugely important, so much so that UCLA has started a policy lab to understand what is causing the disproportionate impact of coronavirus deaths and cases to proliferate in this community.
You know, this is interesting and it's important, and thank you for pointing out the different factors. I think you pointed to about 3 different factors at least that could be contributing to this. One of the things I wanted to ask you is, are we learning anything more about the cultural factor involved? I mean, what is it perhaps within the culture that maybe would limit or cause one not to go get tested or not to talk about it? What are your thoughts on that?
The UCLA Policy Lab and, of course, the state of California has also been changing their messaging. We tend to just assume that everybody speaks English. There's a diversity of language within the Pacific Islander community. That has been a huge barrier, but also the way this culture, they're very communicative in terms of they like to congregate in church, at home, family gatherings, and also they have, just like Latinos, they have multi-generational residence. That means that grandparents live with younger members of the family. Younger members of the family, up to 25% of them are essential workers. So they're going out to work every day to support their household. And when they come back home, they tend to infect the older members of their household. This community, by and large, does not put their elderly back in nursing homes. What they do is they gather the wisdom and they congregate around their elders at home. So it's leading to more infection rates. Social gatherings are huge with the Pacific Islander community, graduations, even churches. And now the state of California has recognized that it's a separate subgroup with separate traditions. So they're messaging through faith-based organizations, which is really, really touching to see how many pastors, how many people at churches are now tuning in to messaging and saying, we need to social distance. We can stream our religious services at home. And even when we congregate at home, we can wear a mask and we can stay socially distant to prevent these high infection rates. So those are very real and distinct social factors, but also we can't overlook the social economic factors as well. There's a lot of food insecurity. There's a lot of underlying factors such as diabetes and obesity. And the number one killer in the Pacific Islander community is heart disease. So when somebody gets sick with COVID-19, all of that takes extra ramifications. They end up being hospitalized, and ultimately these death rates are being shown nationally as being some of the highest, if not the highest. And about 30% of the states in the United States are now separating the Pacific Islander community COVID rates from their Asian counterparts to be able to drill down and message and prevent a lot of the stigma and shame that comes in that community with having these COVID infection rates. So they're trying to deal with it, and part of it is messaging like what we're doing now and communicating so that there's no more deaths and lower the cases in the Pacific Islander community.
This is so important, and that you are highlighting and bringing this to light, because it's important for even those of us outside the culture to understand what is happening and what may be contributing. And like you said, Esther, that the messaging is key here in trying to reach these specific racial and ethnic groups, really not just here, but across the country, in hopes that they will modify things on their own for the betterment and the safety of their family members. Great conversation, Esther. So good to see you. Thank you so much for taking the time this Sunday morning. And if I don't see you, I hope you have a great week and a Happy New Year.